Howdy and welcome to Urinary 1 Endocrine Functions. So this is the second podcast for Urinary 1. Kidneys do a lot of things, have a lot of functions, but this podcast is going to deal specifically with their endocrine functions. So kidneys produce both hormones and enzymes. And we talked about this when we did the blood system, and we said that EPO, or erythropoietin, was secreted from the kidneys, and it helped. The EPO travels to the red bone marrow and binds with EPO receptors to make red blood cells. And when you make red blood cells, that increases your ability to carry oxygen in the blood. So if you look at the right side of the cartoon at the top, it says hypoxemia. So anything that has emia, the end of it, it's going to have to do with the blood. And hypo means low or below. So hypox and ox then, and the ox is for oxygen. So hypoxemia is low blood oxygen. And in the cartoon it's written as inadequate oxygen transport, which would be an inadequate number of red blood cells because red blood cells transport oxygen. So hypoxemia, or low blood oxygen, is sensed by both the liver and the kidneys. The kidneys mainly secrete a hormone called erythropoietin, or EPO. And like I said in the blood lectures, we learned that EPO travels as a hormone in the blood to the red bone marrow, where it binds to EPO receptors and accelerates the process of erythropoiesis, which is just the creation of red blood cells. So if you accelerate erythropoiesis, you're going to increase your number of red blood cells. An increase in red blood cells will increase your ability to transport oxygen, and then this will result in a negative feedback loop. So you started with low blood oxygen, hypoxemia, and you worked in a negative feedback fashion to increase blood oxygen. So that's one important kidney hormone, is erythropoietin, or EPO. The next important kidney hormone is renin, and the renin-angiotensin-aldosterone system, which is the next slide. So if you look at this cartoon, on the left side, you can see the liver and the kidney at the top of the screen. And the initial stimulus then is that yellow box pointing to the kidney where it says a drop in blood pressure. So the initial stimulus to turn on the renin-angiotensin-aldosterone system, or the RAAS, is for the blood pressure to drop, aka a decrease in blood pressure. When your blood pressure drops, there are special cells in the kidney that can sense that drop in blood pressure, and they release the enzyme/hormone renin. And renin then, once it's in the blood, can cleave a blood protein called angiotensinogen. So the liver is constantly making angiotensinogen. Angiotensinogen is always in the blood. When renin is present, because there's low blood pressure, renin will cleave angiotensinogen into angiotensin 1, or Ang1. Angiotensin 1 still is not the active form of the molecule. Angiotensin 1 has to get cleaved again into angiotensin 2, and angiotensin 1 gets cleaved in the blood vessels, in the capillaries of the lungs, by a enzyme called angiotensin converting enzyme, or ACE. You may have heard of ACE inhibitors as a legal drug. So ACE then will cleave Ang1 into Ang2, or angiotensin 2. And now remember, you might get lost in this hormonal pathway, but if you always remember what the initial stimulus is, you can figure out what's going to happen downstream physiologically. So now angiotensin 2 is the active molecule. Remember, we had a low blood pressure, so we want to negatively feedback our physiology to increase blood pressure. So angiotensin 2 is a molecule that can travel to the hypothalamus, and angiotensin 2 will stimulate the thirst center in the brain to allow you to drink more water. Drinking more water is going to increase your blood volume, which will increase your blood pressure. So remember, we started with low blood pressure. Angiotensin 2 also does a generalized vasoconstriction of your blood vessels. When you do that, you have an increase in blood pressure. Remember, our initial stimulus was at low blood pressure. Angiotensin 2 can also bind to angiotensin 2 receptors in the adrenal cortex, or the cortex of the adrenal glands. Those glands will secrete a hormone called aldosterone. Aldosterone travels throughout the blood like a regular endocrine hormone and finds aldosterone receptors in the kidney, and aldosterone will cause the kidney to hold on to sodium. Remember, water follows salt, so if the kidney's holding on to sodium, keeping sodium in the blood, then water will follow that sodium and you'll increase your blood volume, thus increasing your blood pressure. So all those three endpoints of angiotensin 2 binding lead to an increase in blood pressure. So the renin-angiotensin-aldosterone system is aimed at maintaining blood pressure. So let's see if we talked about all these things. The renin-angiotensin-aldosterone system is a homeostatic mechanism to increase blood pressure in response to that stimulus, which is a decrease in blood pressure. And then we said that renin cleaves angiotensinogen to Ang1, ACE takes angiotensin 1 to Ang2, and then angiotensin 2 stimulates the hypothalamus to increase your thirst, so you drink more water. And then I also forgot to mention that angiotensin 2 stimulates the hypothalamus to cause the posterior pituitary gland to secrete a hormone that we learned about in the endocrine system called antidiuretic hormone. Antidiuretic hormone works in the kidney to increase water reabsorption, so keeping water in the blood, not allowing water to be excreted in the urine. Ang2 also binds to Ang2 receptors on vascular smooth muscle cells, causing widespread vasoconstriction. And then we talked about the adrenal angiotensin 2 binds to cells in the adrenal cortex that release aldosterone. Aldosterone causes sodium to be reabsorbed or taken out of the urine and put back into the blood, and water follows that sodium. Well, actually, chloride follows the sodium, and then water follows the sodium chloride, which is salt, increases the blood volume and increases your blood pressure. We also, in the endocrine system a while back, we talked about the endocrine function of the kidney. So the kidney plays a role in calcium homeostasis. So in this cartoon, if you look on the left side, it shows that the skin begins making vitamin D, and the liver continues to make vitamin D, and vitamin D is eventually made into its active form. Vitamin D, or calcitriol, which is the active form of vitamin D, is made active in the kidney, and then calcitriol causes calcium to be resorbed out of the bone matrix and into the blood, and also causes in the kidney, calcitriol causes the kidney to hold on to calcium instead of excreting it in the urine, and calcitriol also increases absorption of calcium and phosphate from the gut. So what do you think, if you're homeostatically, in this cartoon, you're homeostatically trying to keep calcium in the blood, what do you think the initial stimulus was to activate calcitriol? If you said the initial stimulus was low blood calcium or hypocalcemia, you would be right. So the initial condition is hypocalcemia, and then you do through calcitriol, you use these three mechanisms of taking calcium out of the bone, putting it into the blood, saving calcium from the urine and putting it back in the blood, and then also absorbing calcium from the GI tract to increase blood calcium, because the original stimulus was a decrease in blood calcium.